Hello, welcome to the Construction Work Health webinar series. My name is Deirdre Rutherford and I am the facilitator for today's webinar. I am a Principal Advisor with Ergonomics Unit here at WHSQ. The inaugural Construction Work Health Forum was held in March earlier this year. The forum was well attended and, more importantly, very well received by industry. We have created this webinar series based on some of the most popular presentations and workshops on the day, so that they may be shared with a broader audience than those who are able to attend the forum. However, if you were able to attend on the day, I'm sure you will enjoy seeing the presentation again. We are fortunate that a number of presenters from the forum have kindly made themselves available to present their presentation from the forum, and we thank them all very much for doing so. This 5-part webinar series covers a range of topic areas. These are Good, Better, Best, Applying Good Work Design Principles to Maximise Health and Wellbeing, presented by Dr Rebecca Loudon. Engaging Your Workforce, presented by Daniel Hamadal. Silica, Managing the Risk, presented by our own Brad Geinitz. Alert at Work, a practical approach to identifying and managing workplace fatigue risks, presented by Jenny Krasny. And finally, Who is at Risk of Too Much Sitting in Construction, presented by Dr Nick Gilson. We anticipate that today's session will take approximately 45 minutes. This is the last webinar in our Construction Work Health Forum Encore series. If you missed out on any of the previous webinars in this series, recordings of the webinars, including this one, will be available on the WorkSafe website in the next few weeks. We encourage you to share this with your colleagues and networks. The presentation itself should take about 30 minutes and will be followed by a short question and answer session. If you have any questions during the presentation, please enter them into the chat box and select Send to all panellists. Or type your question through the Q&A chat box. We will try and get through as many questions as possible at the end of the presentation. Today's presentation is entitled, Who is at Risk of Too Much Sitting in Construction? And I would now like to introduce you to today's presenter, Dr Nick Gilson. Nick is a senior lecturer at the School of Human Movement and Nutrition Science at the University of Queensland. His research focuses on designing, implementing and evaluating innovative interventions that target physical activity, sedentary behaviour and health in the workplace. Dr Gilson regularly publishes and presents the findings of his research and advises and provides consultancy services to industry and regulatory bodies. He also contributes to policy documents that are defining future approaches to occupational health at the population level. I'll now hand you over to Nick to get us started on today's webinar.
Thank you for that introduction, Deirdre, and hello all. It's a pleasure to be chatting with you today via this webinar link on sedentary work and its implications for construction. When I was asked to do this talk, I thought I'd present in 4 different sections or areas. The different sections are there on the right-hand side, which I'm going to talk a little bit about, first of all, a definition of sedentary exposure. I think that's really important for us to understand what it's all about, so you can understand some of the evidence and the research around the behaviour. And then I'm going to talk a little bit about our exposure, how much sitting and sedentary behaviour we do, especially in the occupational space. And then a little bit about the health impact, which is probably one of the strongest research areas that we have at the moment. And I'm also going to introduce a little bit of information there on productivity, which is a really interesting emerging area. And then I thought I'd finish off by talking about the possibility of doing some intervention work and trying to change the behaviour itself. Now, the studies and the evidence that I'll be pulling on is focused on chronic disease outcomes, and this has really been an exploding area of research over the last 10 years, as you can see from that top figure there, and that represents the number of papers that have been published in that particular area over that time period. And that corresponds or complements quite well the more established area of research in the area of musculoskeletal issues and ergonomics, which I'm sure you're very familiar with. But my particular focus today will be on chronic disease risks, health outcomes, and productivity. So if I move first of all to the definition, and this is my working definition that I use a lot in my research. It's from the Sedentary Behaviour Research Network, and the blue text there highlights the key points in that definition that we need to be aware of. First of all, when we're talking about sedentary behaviour, in my context, we talk about waking behaviour. We think about sedentary behaviour in terms of energy expenditure. And that energy expenditure is very low. It's below 1.5 METs. To give you some context, walking briskly will expend about 3 METs of energy. That's 3 times resting metabolic rate. So that 1.5 is indeed very low for energy expenditure. And along with that, we also talk about posture, which is important. And we really refer, when we talk about sedentary behavior, to sitting. So that's a good way to start and to think about what sedentary behavior is. Now the next slide here is important. I thought I'd show this to you just to highlight that we can be highly exposed to sedentary behavior but still be physically active. Now these 2 traces are from devices called accelerometers, which we use to map movement and sedentary behavior across the day. And they're from 2 different individuals. The one on the top there highlights an active individual. You can see that hump there right at the start of the day is when somebody's getting their morning run in. It was about 40 minutes of moderate to vigorous physical activity. But you can then see from the rest of the day, there's a high level of that sedentary exposure. So this person is hitting the physical activity guidelines, but is still sitting for long periods of the day. And then if you look at the bottom figure, that's quite opposite. You see this person is inactive by physical activity guidelines. They're not getting that 30 minutes in of moderate to vigorous physical activity, but they are exposed to less sedentary behavior because they have a lot of incidental movement, and that's denoted by the spikes across the day. So it's important to bear those different patterns in mind when you think about the impact of sedentary exposure. And it's not just about the total amount of sitting time that you have, but it's also about the pattern across the day, how many breaks, how many interruptions you have. Okay, so now I'm going to move on to a little bit about exposure. And of course, we know that sedentary behavior is ubiquitous in society and our day-to-day lives in the modern day. The figure on the left there gives you a nice kind of time flow chart around where sedentary behavior occurs. And we often think of this as 3 distinct domains. One is in leisure time. The second is travel, when we're in the car typically. And the third one, which tends to dominate sedentary exposure, is work, our occupational context. And the figures on the right are very nice data from the US, which show the impact that reductions in occupational energy expenditure have had on total energy expenditure across time. And as we become more office-based, as work becomes more sedentary, we've had a reduction in occupational energy expenditure, total energy expenditure, which I think underpins a lot of the chronic disease problems that we have today. Now, how much sitting does the typical Australian do? Well, some of our work and colleagues' work from around Australia using objective measures, those accelerometers, suggest that people sit from anything to 8 to 10 hours of their working day. And around about half to 3/4 of that is spent sitting at work. Now, again, I'm talking about office-based work here. And we're talking about prolonged sitting, usually at desks. And really, there is not that much evidence or data coming through for occupational sedentary exposure outside of the office-based context. I've had a good hunt around, and these are the only data that I can find from Safe Work Australia, which has a look at different types of occupations outside of office work. manufacturing, transport, construction, agriculture, and health and community services. And you can see here the percentage of exposure risk for males and females in those different industries. And it's still quite high. Now, the big question for us is what is the pattern or the total amount of sitting that occurs in that exposure? And the answer is we really don't know for the Australian population and the Australian industries that are presented there in that figure. I've gone abroad and looked at some international studies and only really came up with 3. One was a Danish study which looked at manufacturing workers, construction and mobile plant operators. And that study was suggesting that construction workers sit for about 3.5 hours a day. Colleagues in the Netherlands are doing some work here as well, and they kindly gave me some of their data, which indicated that about 44% of the workday was spent sedentary in male construction workers, which is lower than office workers, but still quite high. And importantly, 7% of that work time was in prolonged sitting, greater than 30 minutes, which is important for health and productivity outcomes. And then the third bullet there was also fascinating. This was data from the US, a very large study, self-reported, but it's suggesting there may be a compensation effect. So even if we have vigorous physical labor in some construction areas, non-work days may compensate and we get more sedentary behavior outside of work, which I think is very important to consider. So if we move on and think about how much sedentary exposure we have in construction in Australia, the answer is we really don't know. We're getting an indication that it is significant, but we're unsure about the patterns and also the different patterns relative to the different sub-occupations in construction work. So I thought it'd be a good idea now to get your views on this. So what I'd like to do is pose a question for you and to take a poll, which should pop up on your screen now, and ask you to identify which of these different sub-occupations you think sedentary exposure is highest. And then we'll come back to this data in a couple of minutes to see what the poll results are. So while you're answering that poll, I'll move on to my next slide. Just bear with me while I click through here. And this is my first takeaway message. I've got 3 takeaway messages for you. The first takeaway message is we desperately need measurement-based studies and objective measurement-based studies where we can really get a handle on how much sedentary exposure is occurring in those different sub-occupations. If I was to take a guess, I would suggest that perhaps these occupations sit the least. We're talking about manual labouring, tradespeople on site, and perhaps also construction managers and supervisors, although a colleague I was chatting to the other day in construction suggested that these people might also sit a lot because they're driving between sites. And then also areas where prolonged sitting might most occur, power crane operators. Again, I understand these people spend a lot of time above buildings during the day operating machinery. Mobile crane operators, not just driving but operating that machinery, earth moving and diggers, and also of course we have an increasing amount, I think, of office-based work that construction workers participate in. So coming back to your poll, it's interesting that many of you have identified. Do we have the results for that poll? It's coming through. We'll come through back to that in a second, and we'll move on and have a look at the results of that poll as it comes through. Okay, so I'm going to come back to that at the end of the next section, and what I'd like to do now is move on to the next area of my talk, which considers impact. Now, I'm thinking that many of you have seen the media filtering through from the research we've done around sitting and chair disease. You may have seen the 60 Minutes program, which I think was on about a year or so ago, which is a great thing to watch. If you haven't watched that, the link is there for you to have a look at. And you may have seen these newspaper articles. The one on the top right there has linked sitting to be the new smoking, which I think is not quite helpful, because some sitting is healthy and beneficial for us, of course. We need to break up sitting with standing and moving, but we don't want to eliminate all sitting, whereas smoking is very different. There's zero tolerance there with health outcomes. And then at the bottom there, you may have seen these types of headlines coming through around each hour of sitting increases chance of heart disease by 14%. So there's a strong evidence base coming through for the health impact of sitting. But you may have also seen these articles coming through from the local press in Australia. This is one I picked up while, of course, I was standing on the train through the metro. Sitting does not shorten your life. This was from a large UK-based study, which suggesting that it's actually physical activity mediating sitting, which is important. And the one on the right there was reported from the Australian, that sitting is okay as long as you keep moving. So if I was to look at the evidence base for impact, and you'll excuse the pun, but we as researchers are beginning to construct the epidemiological evidence base about the interaction between physical activity and sitting. But I really want to leave you with this slide, which I think is, for me, the most powerful piece of evidence to highlight why sitting is bad for us in terms of chronic disease. This is a very large study from Canada, which followed around about 17,000 men and women for 12 years, mapped out how long they were sitting for, and then calculated their cumulative survival rate. So basically how many people were not dying during those 12 years. You can see there at the bottom here that the cumulative survival rate is much better for people who are actually sitting almost none of the time compared to people who are almost sitting all of the time. Okay, so that's a really powerful piece of evidence which really brings forward the importance of dealing with sedentary exposure. Now, if I was to quickly introduce and talk a little bit about why that is the case, the epidemiological evidence is telling us that sitting, and prolonged sitting without breaks, is linked to premature mortality, as that previous figure highlights, cardiometabolic outcomes, and some cancers, specifically bowel cancer and breast cancer in women. And the physiological mechanisms linked to this are all to do with muscle activation or activity. And the middle figure in the slide shows what we call an EMG, which is basically tracking the electrical activity of muscle as it contracts and relaxes. And clearly you can see the muscle contracting, using energy expended during stepping, and also getting out of the chair, and also during standing, interesting enough. And then there's very little activation during sitting. Now, when we get muscle activation, we use metabolites in the bloodstream, particularly a protein called lipoprotein lipase, which is a key enzyme which regulates blood glucose and lipid metabolism. We also, of course, use energy rather than storing it as fat. And then there's a new area around gravitational resistance, which comes from space science, which suggests that we have various physiological effects, which when we stand, we counter blood pooling in the lower legs. So there's some energy and some physiological effects which are used to maintain mean arterial blood pressure there. Now, they are the issues around health, and that's a very quick summary of why perhaps we have good health outcomes. But something that's fascinating me more and more is to do with the impact that sedentary exposure has on business, and whether high levels of sedentary behavior are linked to productivity. Now, I've kind of conceptualized this for you as a carrot and stick approach. If I think about the stick approach, first of all, there is perhaps a duty of care for employers around sedentary exposure and chronic disease outcomes. And I've highlighted here the first legal action by a worker claiming compensation linked to prolonged sitting in Australia. the Strode versus Comcare case. And Comcare judged that compensation was not due here, and that was upheld at appeals. But it's interesting to highlight that these types of claims are emerging. And if we think about accountability, we can think about workplaces being responsible for providing good systems that do not require excessive sedentary behaviour. The importance of providing information and training to employees to help break up sitting, and also the importance of measuring and monitoring sedentary behaviour in the workplace so we can react. But if I move to the carrot approach, and think about the link between sedentary exposure and productivity, we know that productivity losses linked to illness and absenteeism are very large. That's a particular statistic there I pulled off the ABS, around 24 billion a year. We can also link productivity to presenteeism, being at work but not being focused and not completing tasks. Now, my question for research and for business and for practitioners, can we link high levels of sedentary exposure to productivity and presenteeism issues? And if we look at the research that's been done so far, the relationship is limited and moderate at best. And that's because I think we have few studies. They tend to be cross-sectional rather than interventional with a comparative or control group. We tend to use self-report measures, which are not the best way of picking up productivity and presenteeism. And also we get poor variability in those studies. So the people we tend to recruit and get involved are those people who feel the most productive. So beginning to look at this in detail, and we've done a really great experimental study which have used standing desks and walking desks to replicate standing and moving in workplaces. And we've measured brain activation in the frontal lobes, which are responsible for decision making. So we've got people to come into our lab, do different work jobs using these different stations, and then measured their frontal lobe activation at the end of the day. And we're beginning to find this, that if you think about what you have during a day as a cognitive resource, and you energize the workplace, so you get standing and moving into the workplace more than just simply sitting. Our participants in that study are focusing better on urgent tasks. They're delegating non-urgent tasks to another day or another time when they can do them, and they're avoiding inhibitory tasks. So really that cognitive resource is being allocated much better to different work tasks through standing and moving. Okay, so my second takeaway message then is that we do have a good evidence base for minimizing the risk of prolonged occupational sitting for health, for chronic disease outcomes. And we're beginning to find that sedentary exposure is linked to work performance. And if you take that link to construction, you can think about the importance of fatigue and maintaining focus and concentration in driving, for example, or power crane operating, where mistakes can be very hazardous. Okay, so I'm about to move on to my last piece, but I'll come back to the poll here. And our responses are as follows. It's looking as though power crane operators are the job application where you think most sedentary exposure is occurring. So that, I think, reinforces the idea that we need to get in and measure these patterns in exposure to identify who is at most need for intervention. Okay, so on to my final bit of the presentation. What could we do around intervention? Well, a good place to start is thinking, what would the intervention need to be like? I'll be honest with you, the evidence base is not at the point where we have specific guidelines for chronic disease reduction in terms of sedentary behavior at the moment. The key question that we're bringing forward in the key guidance is that we need to sit less, move more, and stand more whenever we can. But if you look at the evidence, colleagues in Sydney have suggested that if we reduce every hour spent over 7 hours sitting, we reduce mortality risk by 5%. Okay, if we interrupt sitting every 20 to 30 minutes for 2 to 5 minutes, colleagues from Melbourne and Curtin in Western Australia suggested that we have an impact on metabolic health. And there's a group in the UK who've tried to put forward consensus guidelines around building up standing and incidental movement in the workplace, suggesting that we should accumulate a minimum of 2 hours, increasing to an ideal of 4 hours of standing time. Now, this is a really nice figure from a colleague of mine, which conceptualizes how that pattern might look. If we look at the top bar there, that's typically, I guess, what people mostly do if they get some movement in during their lunch break or their coffee break in the morning, with large blocks of sitting in the red zone there. The bottom bar is ideally what we'd like, so lots of changes of posture moving through sitting, standing and walking. And it may be within the construction industry we have different models which fit different types of workers. The next slide identifies the different sectors and areas that we need to target if we really want to bring about sustained change through an intervention model. We need to consider socio-ecologically policy as the top layer, the organizational approach, the environment, and of course the individual around education and knowledge. Now, from my work, which really focuses a lot on intervention, we're really lacking anything around policy and organization at the moment. Our work is solely focused on trying to adapt, tweak the environment, and also provide education and knowledge to the individual. And I really just want to finish off in the last few slides by talking to you a little bit about an intervention program we've done with truck drivers, which partly focuses on sedentary behavior and the role of the individual and the environment in changing that. This term shifting gears, it also focused on diet, but through this program we were trying to implement more movement and less sitting during driving breaks. It was all about healthy choices. We particularly focused on local delivery drivers. We found it very difficult to recruit long-haul drivers, and all of them were men. And that great picture on the right-hand side there highlights what a difficult and hard to reach this group, this population is. Now, a little bit about the time scale. It ran from July 2013 to December 2014. And those blue boxes there highlight when we went through recruitment. We did some baseline measures on our key outcomes. Very importantly, we ran workshops with drivers where we chatted around some of the challenges and barriers that they faced around healthy choices. And we targeted as well, very importantly there, the opportunities to break sitting and get more moving into the workday. We then did the intervention, and then we did a follow-up. And one of the key aims here, as you can see in that text at the bottom, was to map sedentary behavior and physical activity changes at end intervention and follow-up. Now, very quickly for the intervention process, we gave drivers an activity tracker and got them to download a smartphone application called the Jawbone Up. And this allowed drivers to map out their choices and self-regulate and self-monitor. I'm not going to dwell a lot on the different areas of the application, but I just want you to focus on this orange bar in the middle, which is basically a movement goal. So what drivers are able to do is to reduce their sedentary exposure, focus on movement, and then self-regulate that in terms of the goals that they set each and every day. And we were linked in socially to the application as well as the other drivers as well, so you've got a lot of social support there. Now, I could talk really for hours and hours about the outcomes from shifting gears, but really this is the key finding for this presentation about how the project, the intervention, was able to reduce sedentary exposure in what is a very sedentary group who have to drive a lot during their day. Now, this was sedentary exposure during the day at baseline. So this is not driving time. This is the time they're spending during work time where they are sitting, but they have a choice to stand and move. And you can see there that end intervention and follow-up through the workshop and the self-monitoring approach, we were reducing sedentary exposure, choice sedentary exposure, by about 40 or so minutes at both end and follow-up. Okay, so that leads me nicely to my third and final takeaway message, that I think if we use participatory approaches, we can reduce prolonged occupational sitting in highly sedentary work. And that has good implications and messages for construction. So how do we move forward? And I'll be happy to take any of the questions that you have around this in the next bit. But for me, as a researcher in construction around sedentary exposure, first of all, we have to measure. We have to map out the patterns and the different sub-occupations that we need to target. We need to consult with all the key stakeholders. So that's not just employees, but also managers and also the professional bodies and affiliations. And then we have to pilot test. We have to see what works and why and what doesn't work. Okay? And all that has to occur through support and, importantly, funding, because we need good quality research which can provide good evidence which can then show us the way forward. So with that, I'd like to really thank you for listening. I hope you found the presentation useful and took away some important points. Those are my contact details should anybody after the presentation wish to talk to me, and I'd be very keen on talking to any of you out there who are interested in taking this work forward. Thank you very much.
Thank you, Nick, for taking the time out of your busy schedule to present again for us. We sincerely thank you for doing so. I'm sure everyone would agree that your presentation was insightful and gave us a lot to think about. Thank you for the questions that have been coming through in the presentation. We will attempt to get through as many as we can in the time we have left. The first question is, Nick, how do we persuade managers to take action about reducing prolonged sedentary work when the intervention research is still in its infancy?
Question to start with. That's a really good question to start with, Deirdre. I think, first of all, we recognize that the work is in its infancy, but I think now we're pretty sure that sedentary exposure for chronic disease outcomes is a strong case to make. So we do need interventions. And we need to pilot test those interventions now in the workplace to see what works and doesn't work. And to do that, we need professional affiliation support. So my key suggestion for those out there who are managers who want to move this forward is to lobby the professional affiliations to try and get support for this work so we can move it forward. And then we look at this as a team effort where we bring research teams together with companies, managers, and professional affiliations to explore the issues in a quality way.
Thanks, Nick. Would you encourage companies to tackle small pilot interventions for their at-risk occupations, such as mobile plant operators, tower crane operators, and the like?
Yes, I would, but we need to do that in a systematic way. As I mentioned in my slides, the first step in that is to do good measurement work, so we're very clear on where the issues are. The next step is to then talk and consult with people in that workplace to try and drive a participatory approach, because we have to get buy-in from workers and we have to fit it into their busy lives to make it meaningful. So that would be those are my key suggestions around doing pilot work and moving to pilot work. Pilot work fulfills a role. From the analysis and the feedback we get from those types of studies, we're able then to develop an evidence base which can really inform good practice. And we need to try and gain that momentum towards really sustainable translations. So the pilot work is very important in that systematic approach.
Thanks, Nick. That's very encouraging. Another question, you referred to the app in your Shifting Gears research. Are there apps out and available now that workplaces can use to assist them in this journey?
Yes, there are a range of both commercially available apps and also apps that are free of charge for both Android and Apple phones. The role of apps can be very helpful to empower workers towards healthy choices, particularly around physical activity and sedentary exposure. But what we need to consider is that the role of technology and applications are not a magic pill. It needs to be an holistic approach where we get organizational buy-in, that we're also talking and touching base with workers around their environments and their knowledge and awareness of why change is important. Also, the groups that we tend to deal with, especially in the truck driving community, are not incredibly switched on to the role of this technology sometimes. So while we had good success with the truck drivers we involved in our work and who were fantastic and helped us a lot, we also had a number of drivers who dropped out of the study because that technology wasn't appropriate for them. So it really is important to recognize, and it's especially important for companies and professional affiliations, that simply throwing the ball to workers and saying that it's your responsibility for change will not work entirely.
Thanks, Nick. That's very interesting insight. I don't believe we have any more questions at this stage. So with that, I will thank you once again for participating in this webinar. The recording for this webinar and the previous ones in this series will be available on the WorkSafe website in the next few weeks. Once again, thank you, Nick, and thank you to all for participating, and goodbye.